Okay, well, hi everyone. Thank you for joining us today for our health benefit presentations. We have account executives from all three of our providers that will give overview of our plans and also be available to answer any questions that you may have. With that being said, let's jump right in with our first presenter, Candice Dixon from Blue Cross Blue Shield, to give us an overview of the Blue Cross plans.
Perfect, thank you. I'm just going to share my screen, just one moment.
Sure.
My apologies. Okay, can we see the Blue Cross Blue Shield benefit screen here?
Yes.
Okay, perfect. Thank you guys so much for having me. My name is Candice Dixon. I am the account service consultant for West Suburban Health Group. Thank you for taking the time to review the Blue Cross Blue Shield benefits offered by your town of Needham. Let's get started. This is your open enrollment period. Please note that all benefit selections are effective 7/1/2023, excuse me. You have 4 plans. So we have the Network Blue Select Deductible with hospital choice cost sharing. We have the Network Blue Select Saver. We have the Network Blue New England Deductible with hospital choice cost sharing. And we have that Access Blue New England Saver. The first 2 set of plans are our select plans. We have a Network Blue Select Deductible and we have the Network Blue Select Saver. Before we get into the plans, let's understand the Select Network and Hospital Choice Cost Sharing feature. Benefits are available for services you receive from network providers. The HMO Blue Select Network includes hospitals and doctors in all Massachusetts counties except Barnstables, Dukes, and Nantucket. The HMO Blue Select participating hospitals are listed on this slide by county. Each family member chooses a primary care physician and can change doctors at any time. For visits to a specialist, ask your primary care physician to refer you to an HMO Blue Select Network specialist. In an emergency, you should go to the nearest hospital emergency room for treatment. If you are traveling or have a student attending school outside of Massachusetts, you are covered for an emergency or sudden illness anywhere in the world. To find participating doctors, you should just go to bluecrossma.org, or you can ask your doctor if they're participating in that HMO Blue Select network. Another benefit under the Blue Cross Blue Shield Massachusetts plan, we have the hospital choice cost sharing. Let's see how this works, because understanding it will help you get the right care at the right price and help you avoid unexpected cost. Massachusetts hospitals have been grouped into 2 cost sharing tiers. We have a higher cost hospital and we have lower cost hospitals. Did you know that different hospitals charge different amounts for the same service? Hospital choice cost sharing is based on that simple fact. When you need care, the hospital where you receive your care determines your cost share. You pay more at a higher cost hospital. You will always pay the least quality care when you choose a lower cost hospital. You never have to worry about which hospital to visit in an emergency. Emergency room visits cost the same whether you are in a higher cost share or a lower cost share hospital. Hospitals in all states outside of Massachusetts are lower cost. That's the most important piece, I think, for this benefit, is to know that hospitals in all states outside of Massachusetts are lower cost. This is only for Massachusetts. Here are a list of the 8 higher cost share hospitals, all in Massachusetts. So I'll just take a moment so the group can see what would be a higher cost share hospital. Our plan we have, the first plan we have is the Network Blue Select Deductible with hospital choice cost sharing. Even though this is a deductible plan, you will see that some services are not subject to the deductible. You simply pay nothing or a copay for services. Routine health checkups are covered in full, included related preventative tests, routine health checkups, include annual routine physicals for adults and children, annual preventative gynecological exams, and routine vision exams. The co-payments for diagnostic office visits to a primary care physician, OBGYN, or behavioral health are $20. A diagnostic office visit is when you visit a doctor to treat, diagnose, or monitor a medical complaint or condition. Blue Cross Blue Shield of Massachusetts now contracts with CVS Caremark to manage your pharmacy benefit. So we no longer use Express Scripts. Through CVS Caremark, we contract with most major chains and local pharmacies. For prescription purchased at a retail pharmacy, you will receive up to a 30-day supply. Tier 1, for generic medications, you will pay no more than $10. For Tier 2, preferred brand name medications, you pay no more than $30. And for Tier 3, non-preferred brand name drugs, your co-payment is $65. But be sure to visit bluecrossma.org to find information on your pharmacy benefit. You are protected by an out-of-pocket maximum. The most you will pay each plan year for co-payments, deductible, co-insurance is $2,000 for one member or $4,000 for the entire family, excluding prescription drugs. Please keep in mind, this is a separate out-of-pocket for prescription medication. The most you will pay each plan year for prescription drug co-payments is $2,000 for one member, $4,000 per family. The next plan we have is the Network Blue Select Saver. This is a high deductible saver plan. So it has the $2,000 deductible, $4,000 family deductible. Once that deductible is met, no cost outside of your prescription. You are protected by an out-of-pocket maximum on this plan as well. The most you will pay per plan year for co-payments, deductible, co-insurance is $5,000 for one member, $10,000 for the entire family. Our next plan we have is the Network Blue deductible with hospital choice cost sharing. Benefits are available for services you receive from network providers. The HMO Blue New England Network includes hospitals in all 6 New England states and most of the doctors. Each family member chooses a primary care physician and can change doctors at any time. Your primary care physician will refer you to a network specialist when you need specialty care. However, you do not need a referral to see a network OBGYN, an outpatient behavioral health visit, chiropractor, acupuncturist, or for a routine vision exam. Just be sure to choose an HMO Blue New England network provider for those services. Now, for our Network Blue New England deductible, we have that $300 deductible for individual, $900 per family. Even though this is a deductible plan, you will see that some services are not subject to the deductible. You simply pay nothing or co-pay for services. On this plan as well, you are protected by the out-of-pocket maximum. The most you will pay each plan year for co-payments, deductibles, and co-insurance is $2,000 and $4,000 for the family. Please keep in mind this plan does have the separate out-of-pocket max for prescription medication, and that is $2,000 per member, $4,000 per family. Our final plan we have is the Access Blue New England Saver. Benefits are available for services you receive from network providers. The Access Blue New England plan uses the HMO Blue New England network for participating providers. The HMO Blue New England network includes hospitals, The HMO Blue New England network includes hospitals in all 6 New England states and most of the doctors. The plan requires that you do choose a primary care, but you do not need referrals to visit network specialists. That's why I like this plan. It doesn't need the referral and the need to call the primary care. You refer yourself. Just be sure to choose an HMO Blue New England network provider for those services. The Access Blue New England Saver Plan is a high deductible health plan and meets the IRS definition of a high deductible health plan. However, for routine health checkups such as well child visits, routine physical exams, preventative gynecological, vision and hearing exams, including immunizations and related routine tests, you have full coverage. For your other benefits under the Access Blue New England Saver Plan, you must meet a plan year deductible before the plan pays. The deductible is $2,000 if you enroll as an individual. If you enroll as a family, there is a $4,000 deductible. The entire family deductible must be met before benefits are provided for any family member. You are protected by the out-of-pocket maximum on this plan as well. The most you will pay each year for copayments, deductible, coinsurance is $5,000 for one member, $10,000 for your family. You have access to care through Well Connection. Well Connection allows members to connect in real time through a video visit for medical behavioral health services using a smartphone, tablet, or computer. Tata Needham does offer, they do have a wellness reimbursement, which I think is great. They do have a fitness benefit. It's a $300 reimbursement. You can use it for membership, fitness studio, virtual offerings, and they also have a weight loss benefit, and that's a $150 reimbursement. And you use that for hospital-based programs, Weight Watchers in person, Weight Watchers online, or other non-hospital programs. So I think this is a great benefit to utilize. If you use these services, you get that reimbursement back. $300 is, it's a lot for me. So that is a good benefit to get back. Unlock the power of your plan. Your plan has more benefits than you probably realize. Tap into all of them all in one place. The MyBlue mobile app and online MyBlue account gives you an instant snapshot of your plan, including coverage and benefits, claims and balances, find a doctor, cost estimates, medication lookup, fitness and weight loss reimbursements, Well Connection video visits, mental health resource center, and more. Also, you can get a copy of your ID card and any dependents under 18 on the app. So that's amazing when you need your card real time. Also, we have Visit Blue 365 deals because health is a big deal. Blue 365 brings Blue Cross Blue Shield members page after page of deals and discounts from top health and wellness companies around the country. Blue 365 has deals to help you meet your healthy lifestyle goals. You will find deals that make living well a shared experience. Whether you're planning a vacation, exercising, or cooking a well-balanced dinner, that's what I use it for. Browse Blue 365 and check out weekly deals delivered straight to your inbox. I think this is great to use for dinner and just different things that you may utilize. So it's all on the different person and what they use it for. And lastly, we are here to help. If you need provider information or wish to speak to a Blue Cross Blue Shield team representative about your membership, benefits, or claims, please call Team Blue between 8 a.m. and 6 p.m. Or you can visit bluecrossma.org or chat with us using the AXB feature chat feature, excuse me. And for video doctors, you can visit the website and they will have that link there on your MyBlue. We look forward to meeting all of your healthcare needs. And I thank you for taking the time to learn about the Blue Cross plans. Do we have any questions?
All right. If anyone has any questions, if you could just raise your hand, click the raise your hand emoji at the bottom of your screen, and then we can promote you to so that you can ask Candace any questions.
So I'll start. Candace, is the biggest difference between the two high deductible plans that we now offer, the one that we've been offering, the regular Blue Cross Blue Shield high deductible, and the Select, that the Select is a much more limited number of hospitals and/or providers that will be available to our employees?
That is correct.
That is the biggest difference.
Yes, so it's just basically a different network of doctors. They still have the same credentials and every capacity, but it's just a smaller network of doctors.
Right, so people trying to, gain some savings from maybe joining this program, which is right now, the select one is the most economical one we offer, will need to do the research about, how, if their providers actually are covered within the select network, correct?
That is correct. I would definitely, if you want to think about going over to that select plan, definitely go on bluecrossandmay.org, find all of your doctors, go to that HMO Blue Select and make sure your doctor is coming up in that network. You can always ask your doctor, but sometimes they're not versed in the verbiage of what it's actually called. So I would do your due diligence to go to the website and put your doctors in.
Okay, and finally, I did see something about a hospital's tier 2. So is it fair to say that no tier, what's the highest, tier 3 or tier 1?
Tier 1, I believe.
Tier 1.
The most expensive hospitals?
Yes. Mhm.
Okay, is it fair to say that any tier 1 hospitals will not be included in the select network?
I would have to double check it because I know they were working on the different hospitals being in the select. They should still have access to that, even in the select network. So I will double check and make sure those hospitals are in that select. Or if they're not, just we know that they're not going to be in the network.
Thank you so much.
Of course.
We have another question. I'm just gonna Procurement Central. So I'm gonna just allow them to talk.
Oh, sorry, that's me. It's Melissa.
Oh,
I
hi,
must be
Melissa.
I must be logged in some other way. So I have a question about our current coverage. Basically, is there someone that can help to intercede? So I have the current policy allows for a yearly vision checkup, which I've been doing for many years with the same provider, but all of a sudden they insist that the annual visit should have a copay. And Blue Cross says, no, it shouldn't. And the doctor says, yes, it should. And I'm getting nowhere and it's been months. So is there some way to resolve
course.
that?
What we can do, you can send it over to, I don't know, Justine, and then you can send it over to me and I'm happy to research what the concern is for the claim, of course.
Sure. Yeah, Melissa, if you want to send that to me, I can forward that over to Candace and we can get working on that.
Oh, that would be great. I'm just going around in circles with them and it's making me cross-eyed, which is not good because it's a vision problem. So thank you.
I like that one. Yeah, of course, my pleasure.
Do we have any other questions? I don't see any. I did. Is there, Candace, can you forward me the fitness reimbursement form? That's usually a popular form that people start to look for around this time. So
Of course. Of course, I'll send that right over to you.
great, thank you. Alrighty, well, thank you so much, Candace, for coming and presenting today with all of the different benefit options and all the different plans. Looks like we don't have any other questions, so.
All right, if you guys need me for anything, of course, Justine and Tatiana, you know how to get into touch with me. And I'm happy to help. Thank you guys for your time. I really appreciate it.
Thank you very much.
Bye.
Okay, we're running a little ahead of schedule.
I would say, Justine, we should wait until 1:30, just in case
Okay.
anyone who was looking forward to Harvard joins. So maybe we'll
Sure.
just take a little break from now until, and we'll be back at 1:30.
Okay, so we'll be taking a break about 10 minutes or so, and we'll return at 1:30. All right, welcome back, everyone. Before our next presenter, I just wanted to, as a reminder, I just wanted to let everyone know that I do have scheduled office hours every week during the month of open enrollment. So please reach out to me via email to schedule some time. Tomorrow, I will be over at the Rosemary Recreation Center from 1 to 3 p.m. And then next Wednesday, April 12th, I'll be over at the Public Safety Building in the training meeting room from 2 to 5. So please reach out, schedule some time if you want to go over any benefits for the next plan year, or if you have any questions about any of the plans that we offer. So our next presenter is Lisa Dupre from Tufts Health Plan. Let me promote Lisa. Hi, Lisa. Are you able to turn your camera on and unmute?
Can you guys hear me?
Yes, we just can't see you.
There we go.
Bar. Hi.
I'm not used to Zoom, so bear with me. All right. Thank you. If you want, I can just jump right in.
Sure.
Thanks for having me today. I'm just going to walk through some of the plans real high level, go over a few of the benefits of being a Tufts Health Plan member, and then answer any questions that anybody may have. So just to kind of take you through, you know, the different plans that we have, we offer two plans. One is the benchmark plan, which is a PPO plan. The other one is a health savings account qualified high deductible health plan. These plans have been in place for several years. Nothing has changed. Nothing is changing. And they're very similar to the other plans that are offered by Blue Cross as well as Harvard Pilgrim, with the exception of that limited plan that Blue Cross offers. So I'm just going to walk through. I'm going to start with the benchmark PPO, and then I'll go through the high deductible plan. Now, on our benchmark plan, it is, as I said, it is a PPO. However, you do need to stay within the Tufts Health Plan network. There is no out-of-network level of benefit, but you do not need to get a PCP, and you do not need to get referrals. As long as you're using a network provider, you can go to whoever you want. You don't need to worry about getting any referrals. The deductible on the benchmark plan is $300 for an individual and $900 for a family. Routine physicals are covered in full. And then if you go to your primary care physician for a non-routine physical, you'd pay the $20 copayment. And if you go to a specialist, you would pay a $60 copayment. If you are admitted to the hospital, whether you're sick or you have surgery and you're inpatient, all of the hospitals are tiered. They'll be either a tier 1 or a tier 2 hospital. If it's a tier 1 hospital, it's $500. If it's a tier 2 hospital, it's going to be a $1,500 copayment. Diagnostic testing on the benchmark plan is going to go towards the deductible first, then it would be covered in full. If you have high-tech imaging, which is your MRIs and your CAT scans, that's going to be a $100 copayment first, then the deductible would apply. If you have outpatient surgery or day surgery, whether in a hospital or at a surgical center, it would be a $250 copayment and then the deductible. Physical therapy, speech therapy, or occupational therapy is a $20 copayment, and it's limited to 30 visits per year. Chiropractor visits are $20 copayment, and that is limited to 12 visits per year. One of the new benefits that we added a few years ago was acupuncture, and that is also a $20 copayment, and there is no visit limit on acupuncture. As long as the acupuncturist is in our network, you can go as often as you want with just a $20 copayment. Prescriptions under this plan are covered with copayments, either a $10 copayment, $30 copayment, or $65 copayment, depending on which tier the medication falls under. Now, we do use the Optum Rx pharmacy benefit manager. We changed over to that on January 1st. Most of you, if you're enrolled in the Tufts Health Plan, you would have gotten a new ID card with that information. But that is who our pharmacy benefit is administered through. Going back up and talking about the high deductible plan, this is an HMO based type plan. So you do need to have a primary care physician and you do need to get referrals if you want to go see a specialist. The deductible on this plan is it's either $2,000 for an individual or $4,000 for a family. And I want to pause here for 1 second and just talk a little bit about the deductibles between the two plans because they do operate a little bit differently. On the benchmark plan, the deductible is $300 for an individual, $900 for a family. And on that plan, everybody's kind of marching towards their own deductible. So everybody on the plan basically has a $300 deductible. But as a family, once you hit 900, you don't pay more than 900. So if you have a family of 3, everybody would hit their $300. Once you get to 900, then your deductible is satisfied. Or if you have a family of 6, everybody could hit 150, or you could have one person 300, and it could be mixed and matched, but never to exceed $900. On the high deductible health plan, there is essentially only one deductible. If you're enrolled as an individual, then it would be the $2,000 deductible. If you're enrolled with anything more than an individual, so a 2+ spouse, 2+ children, family, it is $4,000. So everybody collectively is going to be working towards that $4,000. So there would be no coverage until the entire family has satisfied the $4,000. It isn't capped per individual. So I like to point that out because that is a little bit different on the way that the deductibles work between the two plans. Similar to the benchmark, if it's a routine physical, it would be covered in full. But after that, everything on that high deductible plan is going to go towards the deductible before you're going to get coverage, any type of coverage. So your PCP visits, your specialist visits, your hospital care, surgeries, any type of testing, everything's going to go towards the deductible before you're going to have coverage. Once you're satisfied through the deductible, everything with the exception of prescriptions is going to be covered in full. So once you hit your deductible, then prescriptions is going to revert back to the copay structure, which would either be 10, 30, or 65, depending upon which tier your medication falls in. Both of these plans, similar to the Blue Cross plans, also have out-of-pocket maximums. So on the benchmark plan, no family is ever going to pay more than $2,000 or $4,000 in an out-of-pocket max, which includes your co-payments, your co-insurance, and your deductibles. And on the high deductible plan, the out-of-pocket maximum is set at $5,000, $10,000. So nobody's ever going to pay more than $5,000 or $10,000 between their deductible co-pays or co-insurance. Those are really kind of the high level benefits that are on the plan as it relates to actual coverage. But I do also want to talk about some of the discounts and the perks that we have available as being, for being a Tufts Health Plan member. We do have lots of programs around fitness and exercise. Members can have access to gyms across the country. They can get, a week. Some will offer a week trial. Some will give discounts off of memberships. We also have a $150 fitness reimbursement that members can take advantage of. And then we also have access for people who maybe want to work out at home. They want to build a home gym. There's discounts on being able to buy home equipment for your house. We also have lots of programs around online, training classes as it relates to mindfulness, meditation. We have discounts for massage therapy. We still have discounts for acupuncture, even though it's a covered benefit. In order for it to be a covered benefit, you have to see a network provider. But if you're already working with an acupuncturist and maybe they're not in our network, there are still some discounts available that you can look into. We have lots of programs as it relates to weight management and healthy eating. Nutritional counseling is available. We have access to Dash for Health, which is a program designed to help people with high blood pressure, and Dinner Daily, which is a program to help people plan their meals and really helps them to kind of map out what their meals are for the week. And then, online, we also have a lot of tools, wellness trackers, things like that can help, in someone's journey towards weight management or healthy eating. And then we have lots of other discounts, and I've only got a few of them listed here, but discounts on glasses and contacts and senior care, all kinds of things. that are available by just being a Tufts Health Plan member. The one thing I do encourage everybody to do is to, if you're enrolled on our plan, is to go onto our web portal, download the app on your phone, but also create an account online. The online account is going to give access to a lot of tools, a lot of personal health assessments, a lot of health coaching, a lot of different tools that members can take advantage of that are available online. And then we also have our app where members you can have access to your card. If you're walking into a doctor's office, can't find your card, you can pull it up on your phone. You can check, you can change your PCP, you can check your benefits. You can see if the referral's in place. You can see, if a claim has paid, if it's going towards a deductible. So all of those things are available both on the app and online. But a lot of the wellness tools are only available online. So I encourage everybody to log in, and we're always enhancing, we're always trying to add and enhance to those benefits. So, again, I encourage everybody to create an online account and go through it periodically and take advantage of a lot of the tools that are available to them for just being a Tufts Health Plan member. And then my last slide is just if anybody has any questions, please, reach out to me, or you can call our member services. They're open Monday through Thursday, 8 a.m. to 7 p.m. Friday, they're there from 8 to 5. You can also go either just to our website and send an email question, or you can log into your portal, which would be more secure. So if you're going to be going into personal issues, you'd probably want to log in and be in the secure site, but you can send emails to our member services team that way. And then if you're interested or looking for some behavioral health support, you can call directly into our behavioral health department. You don't need to go through member services. You can call them directly, and they are there Monday through Thursday, 8:30 to 5, and on Fridays from 8 to 5. Does anybody have any questions?
I do actually. Can you talk about the health reimbursement? Are we on the March 31st deadline for submission, or the December 31st?
I would have to double check. Most likely it is plan year, so it's probably going from 7/1 to 6/30. But you really have up to 18 months to submit it. So if you have one from last year you want to submit, you can go ahead and submit that as well. We do allow some flexibility with the timing.
Okay, and if you can't do it online because the system doesn't let you, can we, is there another way to submit for reimbursement?
I believe you can submit it online, and I can send over the link for that.
Okay, thank you.
Thank you. We do have another question. Heather Harris, I'm just gonna allow her to talk.
Hey, thank you. Maybe this isn't a question for here, but when I'm looking at the Tufts Health Plan form for enrollment, I'm always confused. And for the the health savings account high deductible plan, what product code is that? With the letter A through Z, or U in this case.
Is it the Tufts Health Plan enrollment form?
Yeah, is it the Advantage PPO Saver?
It would be, no, that wouldn't be the Advantage PPO Saver. It should be an Advantage HMO or Advantage EPO Saver. I don't have the form in front of me, so I can try to pull it up.
The problem is, so Advantage HMO, maybe this is a better question. I should just call Tufts.
I can take a look at it offline. It really you'd probably want to talk to the HR department to make sure that you're choosing the right plan. So I can definitely take a look at that.
Okay.
Mhm.
Thank you.
So Heather, the high deductible plan is the EPO Saver. And then the benchmark plan is, hold on just one moment.
I think on the form though, it doesn't have Advantage EPO Saver. There's EPO, EPO choice copay, Advantage PPO saver.
I can double check and get back to you on that. I can send you an email with the plans. But
Yeah,
I'll definitely get confirmation on that.
Yeah, I have been using Advantage PPO saver and I've used this a lot. So I thank you for that. I just want to make sure because I always feel like I'm wrestling an alligator with this form. So I thank you.
Absolutely. Do we have any other questions? If you think of anything after the presentations are through, feel free to send me an email and I can connect you with any of the presenters' emails and contact information as well. All right, well, thank you so much, Lisa.
Thank you.
Okay, so we do have a little bit of time between now and the next presenter again. So we'll take a little 10-minute break and we'll be back. All right, thank you, everyone. Sorry about that. Welcome back, everyone. So our last presenter for Harvard Pilgrim is Mark Nicholson. Just gonna bring him into the meeting.
Good afternoon, everyone.
Hi, Mark, how are you?
Good, thank you. Good. I'm going to share my screen.
Great.
Can you see my screen yet?
We can't.
Can't. Okay. So this is the issue that I have every now and then. Is there any chance you could bring up what I sent over, Justine?
Let's see. I don't have an email with the presentation from you.
Oh, I sent it just a few minutes ago,
Okay.
Okay.
just in case this would happen.
You anticipated a problem?
Well, we work with Teams, so that's part of the reason we're not that familiar with Zoom. I apologize.
No problem.
Is there any chance that you could resend it? Because it doesn't look like I received it, Mark.
I will do that right now.
Excuse me. Excuse me. Any luck?
I just sent it.
Don't have it yet, but I'm refreshing
Okay.
my Outlook.
In the meantime, Mark, let me ask you a question.
Sure,
It's
yes,
not part of your presentation, but the fitness reimbursement,
yes.
are we on the March 31st deadline or the December 31st deadline to submit?
So great question, and I was going to answer that from what you asked, Lisa. So how our fitness reimbursement works is it goes on the calendar year. So it goes January through December.
Okay.
Now, if you forget to request to submit it, we do have a window that goes through the end of March. So unfortunately, it just missed 2022's window.
Oh, okay.
But for 2023, if it's, you roll around and you get to December 31st and you haven't submitted it, you do have a few more months to go ahead and submit it for next year.
Okay, so we can submit for 22 anymore after March?
No, it ended as of March 31st.
Okay, but we could submit for calendar year 23,
Yes.
as of when?
As of, you need to be on the fitness reimbursement for 4 consecutive months during the plan year. So as long as you're on at a gym club through April, you could actually start to submit for the reimbursement in May.
Gotcha.
Any luck, Justine?
Yes, I'm ready.
Oh, thank you.
I just didn't
Thanks.
want to cut you off.
No, thank you so much. Okay.
Okay, so let me see. Can everybody see the screen?
Yes.
Okay, perfect.
Okay, great. Can I move them or?
No, just have to say next.
Okay, sorry about that. Okay, we can just go to the next slide.
Okay.
Okay, so good afternoon, everyone. Again, I'm Mark Nicholson from Harvard Pilgrim. It's a pleasure to be here with you today. For those of you who may not know, I just wanted to touch briefly on the integration between Harvard Pilgrim Healthcare and Tufts Health Plan. We merged about 2 years ago, and we continue to work on integrating our two health plans for the foreseeable future, at least through this next policy year. You'll still see Harvard Pilgrim Healthcare and Tufts Health Plan will still be operating as separate plans. Next slide. Just to touch base a little bit on our network. So Harvard Pilgrim's network, our core network is primarily the states within New England, except for, as you can see, the state of Connecticut. We are in the state of Connecticut right now. That will change, however, for 2024, where we will no longer be part of the Connecticut network. I don't suspect that would really have any implications to your group. We also offer a PPO plan, although there's not very many people on the PPO plan. That enables you to go outside of our network if you so choose. And in doing so, you would see our partner United Healthcare providers. And we can go to the next one. This is just a slide on how to find a provider. A lot of good information is on our website. So if you are looking up a provider to see if they're in Harvard Pilgrim's network, depending on which plan you are on, you would choose either the ChoiceNet HMO or just hit HMO if you're looking to join the high deductible plan. So as Candace and Lisa mentioned, I think the good news for all of you is that there are no plan changes. There's no benefit changes for the upcoming year starting July 1st. That's always a good thing. So first of all, the ChoiceNet plan, which is our benchmark plan, how that works is that members pay different levels of cost sharing depending on the tier of the provider. So I did hear on Candace's presentation, it sounded like tier 1 on Blue Cross represented the highest tier, but it's actually just the opposite with us. So I hate to confuse anyone, but tier 1 is the lowest tier, then tier 2 and tier 3 is the highest tier. But the good news on this plan is that more than 75% of Harvard Pilgrim's PCPs and specialists and hospitals fall in either tier 1 or tier 2. These are the major benefit categories of that plan. Again, like the other plans that were mentioned, it has a deductible of $300 per individual and $900 per family. A PCP sick visit is $20, and it doesn't matter which tier that provider is on. Specialist visits, as you can see, do matter in terms of the tiers. So tier 1 is $30, tier 2 is $60, and tier 3 is $90. And then you can see the urgent care clinics, that would also just be the same $20 copay. The emergency room is a $100 copay after the deductible has been met. Physical therapy is the $20 copay, and the hospital inpatient The deductible would apply first, and then there would be a copay of either $250, $500, or $1,500, depending on the tier. Day surgery is a $250 copay after the deductible. And high-tech imaging has a $100 copay after the deductible. There is no prescription drug deductible, and the prescription drug copays are the same as the other plans, 10, 30, and 65. And the out-of-pocket maximum also is the same as the other plans, $2,000 per individual, $4,000 per family. And in terms of the HMO HSA, which is the high deductible health plan, again, you can see here, excuse me, that the deductible is $2,000 per individual and $4,000 per family. Then most of the other services are subject to the deductible, other than routine preventive care, which would be covered in full. Once you've met your deductible, then all of those services that are shown would be covered in full for the balance of the plan year. And in terms of prescription drug copays, the prescriptions would go toward your deductible first. Then once you've met the deductible, then those would switch over to the copays that are shown. Just a couple of slides on pharmacy. As Lisa mentioned, Optum Rx became our pharmacy benefit manager for all of our commercial plans in January. So Optum handles the traditional pharmacy coverage, our specialty pharmacy coverage. That's generally speaking the very expensive prescriptions that require special shipping and special handling. And also our mail order program. So even though Harvard Pilgrim still operates the pharmacy program, Optum is the benefit manager that we use to run the inner workings of it. And we use that because we think a single service provider works pretty well for all the pharmacy programs. And just a slide on understanding your pharmacy benefits. It's always good to have a register for an online member account. That enables you to look up your prescriptions, check if your prescription has any special requirements. You can check on your medication expiration dates and things like that. And you can save money through the mail order service. So generally speaking, you can buy a 90-day supply for the same cost as a 60 days through the mail order program. And you can also look up your prescription drug benefits through our website. Your prescription drug plan is the premium 3-tier plan. And as you can see over on the right, the tiers are, tier 1 is generally generic drugs. Tier 2 is preferred brands. And then tier 3 are the drugs that are not included in either tier 1 or tier 2, mostly pretty expensive drugs. Just a couple of slides on behavioral health. With the onset of the pandemic, behavioral health has really been an important topic for everybody, really. And so I did want to just let everyone know that starting on July 1st, Harvard Pilgrim will be moving to an in-source behavioral health program. Tufts Health Plan has had this for a number of years, and it's been very successful. So we decided to move into that type of a program. Right now we have Optum also as our manager of our behavioral health program. So this will be within the house, so to speak. And we feel it will be the best of both worlds. Harvard Pilgrim current providers, as well as providers from Tufts Health Plan that aren't currently in both plans will be there. So we hope to, once this is all set up, to have a very robust behavioral health network. And I believe we'll be sending out some information to members in the next few weeks on this. Starting in July also, we'll have a kind of a behavioral health service navigation program to help members, where to go with their questions, offering them timely behavioral health appointments. That's really a key that we found, during the pandemic, and connecting members with some self-service tools as well. And just to mention a couple of other things, again, this is all on our website, but we have some digital tools for people. Sanvello and Talkspace are both mobile apps. There's a behavioral health access center. Live and Work Well is a website that you're able to go to. And I think if we go to the next slide, it continues. Yes, a couple of other phone numbers: Substance Abuse Treatment Helpline and a National Suicide Prevention Lifeline. So we certainly understand this is an important issue that really has come to light for many people through the pandemic. And then lastly, we also, our telemedicine vendor is Doctor on Demand, and I'll touch a little bit more on that in a minute, but you can also go through them for any behavioral health questions as well. It's worked out very well for a lot of people. You can set up an account, and really the cost is the same as a in-person PCP visit. A couple of other slides. We're committed to helping guide people to the right care at the right time. I think we all are aware, if you look over on the right, the emergency room can be very expensive. It's the place to go if there's a choking incident, convulsions, heart attack, obviously, but it's probably not the place to go if you have a cough or a cold or flu symptoms. So, virtual care visits and retail and urgent care clinics are much lower in cost for members to go to. And we certainly would encourage people to look at those lower cost type situations where they could save money. And I mentioned Doctor on Demand in terms of urgent care virtual visits. Doctor on Demand works really well if you're on vacation and away, you can just make a phone call and talk to a doctor through your iPhone or whatever cell phone you have. It works great for treating many non-emergent conditions. And you can even get a prescription from them as well on that. So a great way to help you out when you're kind of on the run or away from home. Health coaching, I just wanted to throw this slide in, is always at no charge to any members. There are always health coaching is available to anyone. They can talk to a nurse to controlling blood pressure, smoking cessation, managing weight and eating better, lots of different things. So that is always available to all of our members. And over the last year, we've also come up with some new programs in terms of family health and wellness. Ovia Health has some mobile apps. Ovia can help people on fertility, pregnancy, and even parenting questions. And Jen, just to touch on some of our perks and discounts, again, as Candace and Lisa mentioned, we do have a number of perks and discounts, and I won't go through all of these. If you go to the next slide, probably the most popular one is our fitness reimbursement. So you can get up to $150 back toward the cost of your gym club membership. And as we talked just before we started, this is on a calendar year basis. So as long as you're a member of Harvard Pilgrim, as well as a qualified fitness facility for 4 months during the calendar year, you'd be eligible to receive up to $150 back toward the cost of your membership. And then I think lastly, we have a slide on Smart Start. So if anyone is looking at either joining our plan for the first time, or even if you're moving over from another carrier over to our plan, we've tried to make it as easy as possible. We have a phone line that we can have you call with any questions. We can provide education. And there's always people that might have clinical transition questions that we can help you with as well. So I believe that's the last slide. Oh, one more. And we have worked on our digital welcome guide to connect to members. That through that you can access a digital ID card, so you're not always reaching for your wallet and trying to pull out a card. You can have it right on your phone. Confirmation of your PCP, where you can change your PCP at any point in time. Completing a health and personal health assessment. Care management for nurse assistants, and you know, any information on how to get the most value really out of your health plan. So that's what I have for today. We certainly appreciate our longstanding relationship we've had with not only the town of Needham, but also with the West Suburban Health Group. So thank you very much, and glad to answer any questions.
Thank you, Mark. If we have any questions, if you could just raise your hand and then I can promote you so that you can ask it. Looks like we have one. Let me just move over. It's Matthew. Here we go. Hi, Matt. If you can unmute.
Can you hear me?
Yes, we can.
Okay, thank you. So I have one question and one comment. My question is, I have the high deductible plan with the medical and the prescription drug each having a $4,000 deductible, but then the maximum out of pocket is $10,000. How does that math work, and where's that $2,000 come from?
Okay, so your deductible, Matt, first of all, are you on a single plan or a family?
I'm on a family plan.
Okay, so the $2,000 deductible wouldn't pertain to you. It would be the family deductible, which I don't have that in front of me.
It lists as $4,000.
Okay, yep.
And then
Okay.
the maximum out of pocket is $10,000.
Yep,
So I figure, you know, 4,000 for the medical, 4,000 for the prescription comes to 8,000. Where does the $2,000 come from?
so first of all, the 4,000 for the prescription, that is not, it's just a $4,000 deductible, whether it's medical or prescription, it's combined. The difference, Matt, between the deductible and the out-of-pocket maximum would be any of your prescription drugs that that you're paying now co-pays for after you've met your deductible. The odds of anyone actually reaching that $10,000 out-of-pocket maximum are very slim, I'll be honest with you. That is an amount that the state of Massachusetts has all the health plans put in place for your protection in case you ever had a very difficult and I would say really unique type of year. Because once you've met your deductible, most of your costs are going to be covered in full.
Okay, yeah.
Does that make
makes
any,
sense.
does that make sense? Yes.
That makes sense. And then I guess my comment is, this is not any kind of criticism. It's just you guys are involved in the field. I think that sometimes there's a disconnect between the medical staff at a treatment facility and the plans that are sort of changing. Like I see the plans change year to year. And so when I call my kid's doctor's office, sometimes the people at the reception desk don't quite understand the nuance of how our plans work. And for instance, I was directed at one point by the doctor's office to take my son for stitches to a hospital, to an emergency room. And it cost me $1,500 for the stitches and $1,500 just to go to that facility. It was a facility fee that was tacked on. And when I called them back just to let them know, they had no idea that that would happen. And a similar situation happened when I was seeing a specialist about rehabbing my knee. If I met that specialist in a hospital setting, they added an extra $1,000 just for the facility. Whereas if I met that same specialist in a medical building in the suburbs that wasn't a hospital, they didn't have that. But no one on the medical providing side could tell me what that number would be. And so I think there's sort of a disconnect. And if you are speaking with your colleagues, maybe a way that you could communicate with the admin side of these doctors' offices so that they could provide us, the users, with, accurate information. Because I mean, obviously with the high deductible, we want to be good, educated consumers. So that's just a comment. But overall, really happy with the services. So.
Matt, if I could just reply back, your comment is a great one. And, whenever I actually have my own physical, I'll ask the people at behind the window, how do you keep track of everything? And the response that I got the last time was really kind of eye-opening. They said, you wouldn't believe, Mark, they literally have to deal with hundreds of different benefit plans when you consider Blue Cross, Harvard Pilgrim, Aetna, Cigna. So I do understand there are situations where things slide through the cracks. We do have a provider relations area that will go out to the providers and try to go over all of our plans and how they work and the nuances between them. But it's a big lift, I think, for those individual doctors' offices when you consider all the various benefit plans that they deal with. So not to make excuses, but I just wanted to throw that to see if you.
No, that makes sense, and I appreciate that. Yeah, they must be under a lot of burden to keep up, and yeah, so it's not meant as a criticism, just the better we can do about keeping that communication. It'll help us because, I've certainly learned a lot. The high deductible makes me an informed user of the health plan a lot more now that I pay for everything.
Great. Yeah.
I actually will also want to offer, Matt, for you or anyone that has questions about their billing and would like a second look, or for someone to advocate on your behalf. The West Suburban Health Group does offer the Pinnacle Care service. Justine sent an email about it back on October 14, 2022. And I think, again, with the benefits with the open enrollment, but that service is completely free to you, and it actually does have billing negotiation services. We have heard of people who actually successfully got their bill lowered through them, so worth a call.
Thank you.
They will be attending next Tuesday's webinar. So if you're interested in that, Matt, definitely log in and join us for that webinar.
Great. Appreciate it. Thank you, guys.
Thank
Thanks,
you for your
everybody.
question, Matt. All right, do we have any other questions before Mark leaves us? Looks like we do not. So I just want to say thank you, Mark, so much for your time today. It was really informative.
Thanks so much and have a good day.
Thank you. And thank you everyone else for joining us today. If you think of any questions since the presentations are now over, feel free to email me and I can either forward them over to the account reps or try to answer them myself as well. So like I just said, we will be having a voluntary benefit webinar on Tuesday, starting at 1 p.m. And we'll have all of our voluntary vendors, Aflac, IMED, Delta Dental. So feel free to join us next Tuesday at 1 o'clock. Thank you.